are very happy. Yeah, we're very happy to invite all of you to this afternoon's program at CSDS. For Tanja, it's been a long day for us here to talk about the digital. We had a day-long masterclass on digital ethnography with colleagues from University of Naples, and several of the people in this room have been part of that workshop the whole day. They all look forward to the talk this evening. This series of talks that we are organizing is part of a conversation and research project that we have at CSDS on technology and society, very broadly speaking, more specifically on digital technology and society. There's a specific project that we're doing currently on digital technology and health, in which we ask a series of questions about how technology aids or disrupts health provision, different systems of medicine as they articulate themselves online, how is expertise made and unmade in this digital world, and kind of similar questions around how we can do research on digital health and what kind of questions are important questions to address in our times. And of course, post-COVID, this has become a very, very important issue. So we're very happy to invite Tanja Ahlin this afternoon to present to us her lecture. I'll briefly introduce Tanja. She is an anthropologist of health and technology based at University of Amsterdam. She is the author of the book Calling Family, Digital Technologies and the Making of Transnational Care Collectives. Oh, there it is, wonderful. Published last year from Rutgers University Press. She's also been part of other projects on health and technology, including around hearing, around disordered eating, and also issues of gender and gender expectations and impacts on women's health, mental health. This afternoon, she will talk to us on digital technology for remote elder care in Keralite families. And all of us are quite eager to listen to you, Tanja. So the rest of the afternoon is yours, 45, 50 minutes, and then we'll take questions from the audience. So Tanja, please.
Fantastic. First of all, thank you very much for having me for this seminar. I really appreciate the invitation. And I always especially appreciate invitations from India, because that's where my work has been based. And I think it's really fantastic to be able to share it and also to hear feedback again and again. So let me share your, let me share my screen with you. This one. Right. Can you see this? Yes?
Yes, yes.
Yeah, okay, wonderful. So I'm going to talk about the book that you mentioned, Calling Family, and how care is enacted at a distance in transnational families. So within this work, there are several assumptions that I actually challenge. So, and you know, my work actually touches very different disciplines. It's at the intersection of aging and care studies, philosophy of care, transnational studies, migration studies, healthcare studies, and also policy, especially on telemedicine and telemonitoring. So at the beginning of my PhD, which is at the core of the book, I was reading literature across all these different areas, and I was coming up against this, you know, these are some of the assumptions that I've met. So, and that I also came across during my fieldwork when I was talking to different people. So one of the core assumptions is that care is possible only through physical proximity. So people need to be together in the same place, and that is pertinent to aging and care studies. Another assumption is that care is only a matter of people. So those who are involved are caregivers and care receivers. But then through my work, I found out that what matters for care and also for good care is not only people, but also, larger systems like healthcare organization and migration systems, but especially I focus on the objects, so objects of technology. And I find that these also matter quite a bit for care. Another assumption I came across was about calls, so cheap calls. So that comes from the literature on transnational migration and transnational families. And it appeared about 20 years ago when calls, international calls, became really, really inexpensive. And in this literature, I came across this idea that the cheap calls are the social glue of transnational families because they keep families together across distance. And I agree in the sense that the fact that the prices became much lower for such calls, it was truly important for these family members or for any relationship really that is being done at a distance. But it's not all. So, the fact that it is possible to call somebody, that there is a technology, that there is the infrastructure, it's not the only thing that makes these relationships ongoing. So I will talk about that later on. And I will return to all these assumptions at the end of the talk. The fourth assumption that I want to mention is that often care and healthcare are considered two distinct phenomena. So healthcare is usually something that happens in institutions such as hospitals and care homes and so on. But care is delegated often to personal private homes, and these two are also often separated along different lines of professions. So you have professional healthcare workers like doctors and nurses on the one hand, and on the other hand, you have perhaps family members who act like carers. But in my research, it became obvious that these two are not always so distinct, and quite on the contrary, they are often very well linked. And finally, I want to mention the assumption that engaging technologies in care should increase efficiency and decrease costs in healthcare. And that was the premise that I came across when I was looking at telemedicine, telemonitoring, and so on. So there in this field, there was the assumption that if we include technologies in the process of healthcare, this would reduce the need for healthcare staff, like nurses especially, because they would not need to, for example, travel far to see the chronic patients that they were monitoring, right? So just to give you an example, if you have a number of patients who have a chronic disease, like a chronic pulmonary disease, and then they need to be monitored quite regularly. And of course, one option is that a nurse would travel to these different patients by car, and then she would see them in a regular basis, every once in a while. But if we include technologies in this, so the nurse would be able to monitor these patients at a distance, then you reduce the number of traveling hours, perhaps you reduce the number of nurses that need to do this job, and then you also can reduce the funding. But it turns out through research, my research, but also other people's research in this field, that isn't always necessarily the case. Actually, most often it really isn't, because what happens is that instead, technologies actually reshape the tasks and the routines of work rather than completely, eliminating some of these tasks. So I first became interested in care at a distance about 15 years ago, when I started observing telemedicine and telehealth and telemonitoring as a practice in healthcare. And I was really surprised to see that there was a lot of money, a lot of funding going into designing this highly specialized technologies for care or healthcare at a distance. And these projects were often quite successful in the pilot stage. But when it came to spreading them out, so to rolling them out and implementing them at a higher level, so national level or even international level, things became often quite complicated. And often they would say, well, it would become the problem of the people who are supposed to use them, so the nurses, the doctors, and the patients, and they were often described as being resistant to these technologies, or not having the skills and not willing to learn the skills and so on. So it was truly fascinating to me that so much funding at national and international levels was going into these technologies, but that they were so difficult to implement. So in a way, I designed my research project as a reaction or a response to these developments. And I said, well, what about the everyday digital technologies that a lot of people are already using, if not everyone, but quite a lot around the world? And these technologies are quite well accessible and available to many people. They are, easy to buy for many, to maintain, and also to learn how to use, and so on. So how about this? The people are already using the mobile phones. And then I was wondering, how could these devices shape care at distance? Or are people using them? How are they using them? And what do these technologies do? So here I employ, so my background is really in anthropology. So I approach this issue or this topic through anthropological lens. But at the same time, I really struggled with the vocabulary. At that time, there were very few people within the field that were working on technologies in any shape, any kind of device. So I joined my inquiry as an anthropologist with science and technology studies. So this really gave me the vocabulary to look at what digital technologies, not just how people use them, but also what do these technologies do to people and to their relationships and even to their identity. So it's really about looking at them not as just communication tools to achieve the means of communication, but as actors, as something that participates within our relationships, and something that we can engage in our practices of care. So to look at care at a distance, I found that transnational families could really be a fantastic example, because transnational families are families in which members live all around the world, right? So they can be spread all around the world for very many different reasons. And people move for personal reasons like relationships, but they also move for studies. And at the same time, the number of labor migration, so the scale of labor migration, has really increased in the past several decades all around the world. And so I focused on one ethnographic case study that I've come across, and these are transnational families of nurses who come from Kerala in South India, and they migrate. And so these families have at least one of their adult children who is a nurse, and who migrated abroad for work, right? And this is what I write about in my book, and I will present a part of this story in this presentation. Then, of course, I'm very much looking forward also to your questions. Now, female labor migration really increased significantly all around the world. And in Kerala, I found that nursing is one of the major migration strategies, especially for women, and then in the past decade or so, also for men. So lots of young people in Kerala are caught in a dilemma, because on the one hand, they have poor employment opportunities, and then on the one hand, often for them, the best way to actually help their family is to gain qualifications in nursing and then to move abroad for work. But then at the same time, that means that their parents might be left in India, sometimes often by themselves, living by themselves. So there are many migration destinations for these nurses. They are going all around the world. They started in the 1960s or so, going to the US. Then many also started going to the Middle East, of course, and other European countries. And today they're often in Australia and even in countries such as the Maldives and South Africa. So all around the world. And here you can see two posters. One comes from the UK and the other one from Oman. And of course, these migration flows for nurses are very much influenced by the global politics and the global economics. So the flows change through time. And you can see, for example, that there are one of the main differences that you might notice in these two posters. By the way, I found these posters, they were shared with me by the nurses that I met in Kerala. And often this traveled through WhatsApp groups or online. So they're not actual physical posters as much as they travel online through social media and are shared with people interested in going abroad and so on. So one of the main differences here is the requirement for the English language. And you can see that on the poster for the nurses in UK, the required IELTS score is 7 for all modules. And actually, that is quite a high demand. So all modules are speaking, listening, writing, and reading. And I've met many nurses in an English language school who struggled with achieving this high grade of 7 in all 4 modules. At one point they would miss one, at another they would miss another one. And they really could struggle with achieving this. And they would sometimes try the same exam 3 or 4 or even 5 times, which of course was also very costly. By contrast, in Oman, you can see another poster, and that one doesn't really mention the language requirements, right? So what happened was that there was a certain hierarchy of migration destination countries. So people often wanted to go to English-speaking countries first for a variety of reasons, but among them were also the fact that, of course, the salaries were quite high. That was very attractive, but also they could ask for permanent residency, and that would mean a pension, and they could also invite their family members over and so on. Whereas in countries of the Middle East, that was not the case, right? They wouldn't get a permanent residency. So that was always challenging for many nurses. But if they didn't manage to pass the IELTS test, then they would, instead of going to an English-speaking country, they would go perhaps to one of the Middle Eastern countries, and they would still often look for ways to go further to one of the either to the US or the UK or some other countries in Europe or Australia. I also want to mention that these migration flows really changed based on the politics. So Brexit is one of such events. In 2017, it really changed the dynamic of the nursing flows. So there was a graph published in The Economist showing the number of foreign nurses in the UK. And then at that time, before 2017, there were a lot of nurses from the European countries. And around the 2017, this number really plummeted. It went down like this very sharply. And at the same time, the number of Indian nurses in the UK went like this, up. So it was like completely in the opposite direction. And I also learned that at that time, the requirements for IELTS test actually were lowered. But of course, that doesn't make migration much easier on people, because I also heard that the visa requirements changed. So how long you can stay, how much you have to pay for the visa, and also when are you allowed to bring your family members over. So now, the way I designed my fieldwork, I initially considered doing multi-sited fieldwork. So that is a very common kind of fieldwork that is done in migration studies. So you would go to the country of origin, for example, and then you would follow the migrants to wherever they are going to physically. And that's also what I plan to do initially in my research. And I went to Kerala. I spent 5 months there in 2 different visits. And then I also went to Oman as one of the destination countries for nurses. But while I was in Kerala, I was really surprised to also be put in touch all of a sudden, unexpectedly, with nurses living in other countries around the world. So I was put on the phone with a nurse who lived in the Maldives, and I was asked to have a Skype conversation with nurses living in the UK. Then I was wondering, should I stick to Oman or should I open it up? And I decided to just go with the flow and open this research design to other countries in the world. And so I also interviewed nurses living in Canada and the US, Australia, Germany, and this happened either on the phone or on Skype, or sometimes, especially in the follow-up interviews, often on WhatsApp. So either this would be video interviews or exchanging messages. And I was really struggling with how to talk about this kind of fieldwork for quite a while. And that was before the pandemic even, because when in academia, when I went to these different conferences and people would ask me, well, where is your fieldwork? I suddenly really struggled with the answer. Because sure, I was in India and I was in Oman, so that was pretty clear. But what about all these other sites that I didn't visit in person? Was I also doing fieldwork there? It wasn't quite the same, right? So I came up with this notion of field events to describe the kind of fieldwork that you're doing when you are doing both the face-to-face fieldwork, but also including digital technologies in your interviews and in your observations. And I'm happy to talk about that more, perhaps in the Q&A if there's time. But the idea here is really to consider how these digital technologies actually shape the field. How do these different kinds of technologies, whether they allow you to see your interlocutor or not, if it's just about the messages, if it's about sharing documents or photos and so on. So how do they actually shape the kind of relationship that you can develop and also the kind of data that you can obtain? So I think this is really important for everyone who is doing such fieldwork with digital technologies to really consider it seriously. So if we get to the core of the work, well, when I landed in Kerala and I was starting to look for interlocutors that I could, people that I could interview, I shared with some of the locals that I'm looking for older parents who have children working abroad as nurses. And one of them quickly started to laugh at me and said, "Oh, that's impossible. They will never talk to you." And I was really shocked by this because I thought, oh my goodness, what am I doing here? How is this going to work? And why wouldn't they talk to me? And actually, it turned out that, this person who said that said, well, there are these older people who go around and they say they are very proud and they're saying, oh, my daughter is in Dubai and my son is in Australia, and they're so successful and having great jobs. But actually, these older parents are alone and by themselves, and they feel actually lonely and isolated, but they would never want to share that with you because, of course, they could feel that maybe they raised children who are more oriented towards cash rather than care. And also they wouldn't want to talk badly about their children, which is, of course, completely understandable. But so I was really surprised when just a week later, I managed to set an interview with widow that I call Alice. And she had a son who lived actually in Dubai and a daughter who was a nurse living in Australia. They both had their own families there. And this lady was a widow, so her husband had died, but she lived in Kerala by herself in this beautiful house. There was also a car there. And then I asked her, how is it to live by herself? And she was really pragmatic about this. And she said, because my children are abroad, I'm living happily here. If they live here and have no jobs or earn a very poor salary, would we all be happy? No. So, this lady didn't look particularly lonely or isolated. She was very active in the local church community. She had her garden to tend to. She refused the idea to move abroad with her children. And the children indeed were sending her the money. So they sent the money to renovate the house. They also bought the car. But the car she didn't use. It was her children who used the car when they returned home once a year for an extended visit. So those visits were very important to her. But I also learned that there was another thing. They called her, both of them, on the phone every day. So I found that for many families, actually, they really struggled financially often. And this is what a mother of a nurse working in South America told me. Well, we struggled hard to get him educated. Then when he completed his education, nurses were paid very little here. Since he's gone abroad, I'm extremely delighted. And this was, it seemed very true. I mean, it was something that the parents actually were also hoping for. So it was not that the children all of a sudden decided, oh, I want to go abroad because I want to earn a lot of money. So I will just arrange everything and leave my parents and I don't care about anything and I go. It was absolutely not like that. And I found that migration was actually not an individual decision, but it was a family decision. And this made it possible to understand migration not as an act of abandonment, so that the children just abandoned the parents and didn't care for them anymore, but it was indeed a care practice. And it was an important care practice because in India, there's still, as you know, the system of pension doesn't cover everyone in the country, right? And when it comes to healthcare, there's still the majority of expenses come out of pocket, are paid out of pocket, right? So for people growing old from middle classes or lower classes, it's very important to have some kind of financial security also in the old age. And sending the children abroad to earn money and send remittances back home, I mean, this was a kind of a care practice for the parents. If the children lived in Kerala and didn't have a job, or as Alice said, earn a very poor salary, then they wouldn't even become carers. They couldn't become carers for their parents, right? And what I heard again and again from these families was this discussion or this phrases of idioms, so of sacrifice and suffering. And the parents said, well, we sacrificed so much for our children and we suffered so much for them, that of course, it makes sense that they now go abroad and that they send remittances back home. And the children also use the same idioms of sacrifice and suffering. They kept telling me, well, my parents sacrificed so much. And the sacrifice and suffering here really referred to financial aspects of taking care of the children, but then especially sending them for education, because the nursing degree has become increasingly costly over the years. And then also investing in the migration process and so on. So some parents had to work hard. Actually, most of them worked hard to provide for this money, but they also sometimes took loans. And this was all described as really putting effort into the migration process. And then to repay for this sacrifice and suffering, the children got some new tasks. And that was to finish their often nursing studies, to pass the IELTS test, and to migrate. So that was one of them. And the next one was to send remittances back home. And then it was the task of, practice of visiting regularly. And that was at least once a year, or depending on how much their employment would allow. And also to call frequently. And I want to talk about that a bit more now, about the final filial obligation. So, to talk about care at a distance and how technologies become included in this, I use the science and technology studies theory, and which is called material semiotics. So this theory suggests that care is not, it looks at care not as something that is given by the caregivers to some people who are care receivers, but it looks at care as something that's enacted within practices. So what are the concrete practices? What do people do? And these practices involve human and non-human agents. And in my work, it became clear that both digital technologies and money participate in transnational care. So I already talked quite a bit about how money participates in this care. And I propose this notion of transnational care collectives to also show how digital technologies participate in enacting care at a distance. So what are transnational care collectives? Well, in a nutshell, these collectives include different members, so parents in homeland and their children abroad, and then different kinds of digital technologies. And the care collectives are not something that happens overnight, and it's also not something that is self-evident. You have to know that, this is a relatively migration for work, and especially the migration of women for work, is a relatively new phenomenon. It's been only going on for a couple of decades, which is not that much. But that means, excuse me, I just have to make sure that I have, yes, that my laptop is fed with electricity. See, that's caring for technologies. So there are no general guidelines on what care is and how it should be done, right? So for the past couple of decades, people have been really tinkering. They've been quibbling with the different kinds of technologies, and also with different arrangements with different family members and non-family members, to find out what works as care and what works as good care at a distance. So each transnational family establishes its own care collective based on who becomes involved. So is it one of the parents or both parents? Is it, who among the children becomes involved, to what degree? Who among the neighbors and other non-kin members or extended family members becomes involved, when and for what purposes, and so on. And then also, who calls whom and how often. That was very important to find out. And usually it was the children who called their parents, and how often, that also differed. So especially there was a difference between, I found that the daughters were kind of calling home much more frequently than the sons, but it really depended on the family. Huh? And usually it was people called, so the children called every day, sometimes more than once a day, and sometimes they would call a couple of times a week. Also, they were tinkering with different kinds of, with different time zones, with different schedules. When are people going to the church? When are they working? When are they watching their TV series? I mean, this all has to be had to be tinkered about to find out what is a good time to call. And also this included taking care of technologies. So technologies, as you just were able to observe, they need to be fed with electricity. They also need to be fed with credit. And often it was the children who provided the money for the technologies, also provided the money for telecommunications, but it was the parents who had to do that on their side as well. They had to make sure that all the lines were fixed. They had to make sure that their mobile phones were full of credit, and so on. Right. And these are some of the technologies that I came across. So I took this photo in one of the families where there were 3 daughters. 2 daughters were already working in the UK as nurses, and the youngest one was still in Kerala living with her parents. She was also a nurse, and she was studying for the IELTS test, and she was about to go abroad. And she had all these mobile phones, but she was only using one of them, the one with the picture in the middle. And I asked, well, but why do you keep these mobile phones? Like, why don't you sell them or, throw them away or whatever? And she said, no, I'm keeping them all so that one day I can show them to my nephews, to tell them, look, this is how well my sisters are taking care of us, right? So even buying the technologies and giving them to the family members is already a concrete care practice. And then, so one of the most important, some of the most important practices in Indian families, as you know, is living together, right? And things like food sharing, preparing food for older people, and sharing food with them and so on. So these are really practices that demand physically being together. But if that's not possible, as is the case in transnational families, well, I found out that people don't care less, but they have to learn how to care differently. And it turned out that calling was actually one of the most important new care practices in these families. And this is what one of the nurses, Anthony, who lived in the UK and then Australia, told me. I think the most important part of care is the understanding. It's trust. It's not touching. It's not giving money. So even money was not that important. I call them daily. That's a gesture. That's a way in which I show my love. So he said, I share everything with them. They share everything with me. Well, we're informed about each other's lives. And that was a crucial care practice. Okay? But of course, calling, if calling is care, then what does it mean? What does good care mean in this situation? And this is what Sarah, who lived in Oman, told me. If I don't call for 2 or 3 days, even if it's because of my work schedule, then my father would say, ha, are you becoming like your brothers? Have you changed your mind? You're only calling us weekly now? And he would laugh. And he also said, well, he will ask me like that, and then I will know how he's feeling, sad that I'm not calling. And that's why he's jokingly complaining. But they're not getting angry. Everybody wants to hear their kids sound, right? So you could see, I mentioned here earlier that there was a difference between sons and daughters. And daughters often called more often, but I also came across sons who were very engaged with their parents. And it turned out then that frequent calling became a practice of good care. And then not calling frequently or not frequently enough or on schedule, that could indeed be considered a sign of neglect. So there was one family, for example, where the son went abroad to the UK for the first time, and he didn't call back home immediately. In fact, he didn't call for 2 weeks. And his parents were absolutely devastated. You know, this was the first time that he went abroad. They had no idea where he was going, how did he manage there, and so on. But that doesn't mean that they were passively waiting for his call. They became very active, and actually they activated their network to track down their son in the UK. So through that, their son learned that it was really important to call the parents. And then only he realized, well, that is something that I have to do. It's important for them. So thereafter, he started calling them frequently. So this is how people tinker, right? This is how they find out what is important and how to do it. Now, what did people talk about if they call each other every day? Well, that depends on what kind of technology they are using. I found that different types of technologies afford different things to different people. So if we consider the phone, On the phone, it's really not it's really impossible to see the other person, right? And we have to rely on what the people are saying. We have to learn how to listen to their voices and their tones, but we also have to listen to their silences. And actually, it's quite difficult to be silent on the phone, because that could mean that something is going wrong. So it could be something could be wrong with the connection, or something could be wrong with the emotional connection. So people learned how to talk about the everyday details of their lives. They would talk about the church, they would talk about the plants, they would talk about what they had for lunch, or the neighbor's children, or all these kind of things that are sometimes considered mundane, or everyday and trivial even. But it turned out that for these families, they were not trivial at all. They were a way to share everydayness on the phone. And then on the webcam, paradoxically, because you can see the other person, that also makes it possible to be silent with the other person much more easily. And I found that families were often spending time together on the webcam. They would just keep their laptops or devices open, and they would go about doing other things like cooking or cleaning, and just be together without actually having to speak. And that was especially important when there were grandchildren in the picture. So grandmothers especially were really eager to keep a relationship, to build a relationship and keep that relationship with their grandchildren at a distance. And for that, the webcam was especially useful, because often these children wouldn't be able to speak yet, right? But they could play. So, and that also changed through the years. As WhatsApp became increasingly important. So I started doing my fieldwork in 2014, 2015, where most people would be using just simple mobile phones, and then sometimes laptops and tablets, but they would need some help for that. And then towards the later part of my fieldwork, like in 2020, 2022, I was talking, doing some follow-up interviews, and people would tell me, well, Skype is a thing of the past now. We're just using WhatsApp now because it's so simple, even for the older people to use that. So even older people would be communicating through videos or pictures and so on. And that became quite important, especially in the COVID times, for different reasons that you might expect. So during the COVID, the shift of concern, so the concerns shifted from the care for the elder parents, often to caring for the children, because it was the children who, as nurses, were working in highly risky environments, right? So the parents were then very eager to be in touch with their children, to know that they're doing okay, that they're not getting sick themselves, that they're taking care of themselves while at work and so on. And there was another concern, and one of the nurses told me that they read about COVID children, and those were the small children who were not being able to go to school or to daycare or to hang out with their peers, and that had a super detrimental impact on their socializing skills, but especially on their language skills. So for that, what became important was the interaction with the grandparents through digital technologies. Right. And when that was, so before WhatsApp, as I mentioned, this kind of technologies like tablets and smartphones were not commonly used by the older people in Kerala. So what often especially sons did for that purpose, they asked a good friend to drop by their parents' house and to bring along their smartphone or their tablet and establish a visual connection. And one of the reasons for that was also that they were quite aware of the fact that the parents might sometimes not want to share certain things with them on the phone, especially if there was something concerning, right? One mother told me, well, so John's father actually had an accident. He had a broken shoulder, but John didn't know about that. He only learned about it when he returned home after being abroad for 3 years, and he saw the stitches in his father's shoulder, and he was really shocked because he didn't have a clue. So I asked the mother, how come that they didn't share this? And she said, well, there's nothing he could do from so far away, so why bother him? He would only be tense. That's why we didn't tell him. He's not very near to us to come running for help. But that was much more common for sons, whereas with the daughters, they were often sharing much more. And so the daughters were often also involved in the healthcare of the parents. Now, the final thing I want to mention is that sometimes there are certain practices that we don't really think of as care for the aging parents, such as this. When I'm in Kerala, I just invite my friends for a drink and we have a kind of a party. And normally you wouldn't really connect this to care for the aging parents. But in this case, it actually turned out that it was. So this comes from Aaron. Aaron was a single son, an only child, a son, who lived in the UK. And actually, he was very concerned about his parents because his father had a chronic pulmonary disease. So he was super involved in his father's healthcare. And for that purpose, he also made sure that he was maintaining good social relations with his friends, because he knew that sometimes he might need them to do the very practical things for the parents. And that actually turned out to be the case during the COVID pandemic, when his father, who was already a chronic patient, contracted COVID. And what happened was that Aaron really had a trouble finding a hospital that would take the father in. And he was arranging all that at a distance. So he asked one of his friends, who was also very politically active, to help him find a spot in the hospital for his father. So, and that's what happened. So, and in this case, it really was a matter of life and death. So, to wrap it up, very briefly, transnational care collectives are kind of global assemblages of different people and different technologies who enact care together within concrete practices, such as frequent calling. And these transnational care collectives are very dynamic. They change from one family to another, but they also change through time as people age, as different health conditions arise, but also as different, outside circumstances change, like the pandemic happens. And these collectives are established with digital technologies, but also with other non-human actors. And in this case, money was really important. And they are maintained through affect. So I mentioned that it was really important for grandmothers to be in touch with their grandchildren. So for these people, the most important was the feeling of love that they actually had for each other. The grandmothers were, and also the grandfathers, were super concerned about their children and also grandchildren. So I would argue that, it's not just the technology that's making this possible, but it's actually these underlying feelings. And they can be feelings of love, but they can also be less positive feelings, like feelings of obligation, for example, that some children also felt towards their parents, right? So the whole range of feelings that supports transnational care collectives. So I think we tackled all these assumptions. So I would say that people don't care less in a transnational context, but learn how to do that differently. And I've shown that material objects like mobile phones and the webcams really shape care in significant ways. I've just explained that affect is, that I would say the affect is the social glue of transnational families, and then the digital technologies support that. And that small and seemingly insignificant acts of care can have significant consequences for health. And with that, I'm referring to partying with friends, right? For example. And finally, I think I've shown that technologies don't decrease the workload, but change the routines of care and also require new skills, such as managing these different kinds of technologies. So I think I would leave it at that, and I'm really looking forward to discussion.
Thank you very much. That, that was wonderful. A lot to talk about. So
Certainly.
I had a couple of observations and then we'll open it for the other members to ask. One was the very initial uh, theoretical distinction that you made between field work and field event. And if
Mhm.
a bit more about the field event part of it, because as I understand it, by its very nature, it's going to be unbounded. And
Mhm.
point as an anthropologist, you have to kind of close it. Which networks will work and which won't. So how does one think about this field event, as you called it,
Mhm.
specifically on the migrating children? You know, I was thinking through the son's best friend that came towards the end.
Mhm.
That is the circuit. Of course, the circuit needs money, it needs other things, but is it really being completed because there is the son's best friend around, or maybe a sibling who didn't migrate? Because unless you have this other human actor available who can go and get the medicine or do whatever else is required, uh, it does become a bit difficult to understand how the family or the kinship relationship has been restructured, because you do find new kin relations in order to complete the circuit. And that was just the thought that I had, and maybe if you could speak a bit more. Uh, Finally, on this calling, this is, yeah, it's really quite something, because I've often wondered what people chat about the whole day on this kind of thing. But no, something really to think about, how such a mundane act of what did you cook becomes an act of care. And thank you for that. There's really something to think with. But if there are questions that people have in the room, or if you want to make some initial comments, and then we can ask questions.
Yeah, maybe I can respond to this before before I forget. um, so thank you for these observations. Yes, yes, indeed, calling. You know, when I first came back from my first period of fieldwork, I went to an event, a symposium, and there I talked to anthropologists about my findings, and I said, oh, you know, it's incredible, like they call each other every day, and like sometimes even 15, 20 times a day, like it would be like constant short calls. And then a senior anthropologist said, she said, so people pick up the phone and call. What's so special about that? What's so fascinating? Like she couldn't really fathom why it's so special. And really, my whole work of the past 10 years is about answering that question. And I think what is so special, I mean, it's because it matters so much to people. People wouldn't do it if it weren't important. And then you need to find, you know, if you're not used to calling each other every day, like, for example, there was a son who lived away from his parents because he went to another part of India for a while, but he didn't call back home very often. And yet, when he moved to Australia, he started calling every day. And of course, there was a tension there because the mother didn't really know what to talk about. You know, she said, "Well, for 20 minutes every day, what do we talk about?" So, you know, but she didn't um, end the call. She went on, like she found things to talk about. Because perhaps at that moment it wasn't caring for her. Maybe she didn't need that at that time, but maybe he did. So it was at the same time, you know, a potential for elder care practice, but it was also self-care, and it was also caring for the adult child abroad who is now in a completely new environment where, you know, he might be facing some struggles at work, or, you know, living in a different country and so on. So it's a simple thing to pick up a phone and call, but it can be a fascinating care practice in many different ways at once. Now, as for the migrating children and the people who are also physically nearby, indeed, they can be very important for the collective. It depends on what the collective needs at which time, right? So, for example, indeed, there were siblings who were important, but I also came across families where there was one daughter living 2 streets away, one daughter living in the Middle East, and one daughter living in the US. And it was actually the daughter living in the US who was the most informed about what was going on with the parents. She was the most involved in their healthcare. She was also going to be the one to inherit the ancestral house. So it was interesting to see how this dynamic worked among siblings. But of course, when when her mother had a stroke, they needed somebody on the ground to actually take her into the car and then follow the advice from the nurse in the US to take her into a specific hospital and what to do, right? So they were really working together. And you are quite right. I mean, even you have to have somebody on the ground when things like severe illnesses or accidents happen, for sure. Or, there was a family with a mother with dementia, and a son in the UK said, what can I do? I'll send money. Oh, happy to send. What do you need? And so on. But it was the sister who took the mother in, who actually said, but, the mother needs somebody to feed her with a spoon. So anyway, so these were they could become very complex questions, and I could talk more about that. Or Aaron, and his, as an only son, he was really depending on his friends for this practical care. But he could also do quite a lot by himself online. So he said, well, Google is my friend, because through Google, he found an ambulance, he located a hospital, he took care of the finances and so on. So he really took off everything, but then he also needed some help with from his friends. And then the final point on work events, field events. So field sites and field events. That is one of the fascinating things about digital technologies, right? It's in the past, it was quite clear, or even in my case, it was clear when my field would started. It started when I had the ticket to the airplane, and then I took the plane, I landed in Kerala the first day of my fieldwork. Great. But then when does the fieldwork end? That's a very difficult question to answer. I'm not sure if my fieldwork has ever ended. Perhaps, and that becomes a thing of decision, right? So my colleague, my co-author, Fang Li, she had a similar concern because she was working with people so she was working in China and Malaysia. She was working with people who were traveling around a lot. And then at one point she asked them to send her pictures of food because she was working on food. And they started doing that, and they sent her a lot of pictures for 2 years when she was collecting data. And then at one point she said, oh, now I really have enough. So I have to finish this. I have to find my way through all this data. So you don't need to send me this anymore. Thank you very much. And the people didn't really care if she has enough data or not. Like, they really liked to send her these pictures of food, and they just kept on doing it. And so she had to decide very purposefully on how to end this fieldwork. And it was, so in a way, to use Marilyn Stratton's term, she decided to cut the network, right? To cut the field. She said, well, I'm not going to use the data, even though I keep getting this kind of data. I'm just not going to use it in research anymore because it becomes impossible and never ending. So these are definitely some of the questions to consider. It's not like, Malinowski did, right? He went to the faraway island, which was a physically limited field site, and he spent a particular time of there doing fieldwork, and then he went back to his home and he wrote about his fieldwork there. But now, of course, it doesn't work like that. So thinking about what is good fieldwork is something that we have to do collectively through practice, right? And I would also add that I don't know if that means, I'm concerned about fieldwork becoming a collection of interviews that people do online. So I'm really trying to encourage ethnographers and field workers to think about how to make fieldwork deeper, even if they are doing interviews online. But how can you also observe? Can you also observe silences on the phone, or what can you, what kind of information can you add besides focusing on what people say, right? I think this is something very important to consider. And I also don't know if how many field events make good field work. That's a question that we are, open to, right? We need to discover on a practical basis.
Yeah.
I will leave it at that. Yeah.
We have one hand raised on screen. We'll come to you, Shivangi, in a minute. We have a couple of people in the room. I saw Prathama want to ask a question. There's one question here that Ravikant wants to ask. Anybody else at this moment? Yeah, you wanted to ask a question? No? Yeah? Okay, so we'll just go now. Just briefly introduce yourself.
Hi, Tanya. Thank you. I am Prathama. I'm a faculty at CSDS. I'm a historian. So it's a semi-historical question that I wanted to ask you. But I wanted to ask you in two parts, one to do with the digital, the other to do with migration. And let's then put that together back. So in course of your in-person field work, I'm sure you have also encountered both in Malayali movies and in Hindi movies and many other regional movies, the fact that children moving out of the country is a big theme. It's one of the most important themes of popular culture today. Even though in terms of demographics, perhaps the majority stay back, the minority migrate. But nevertheless, there is something to the moment since the 1990s, but increasingly now, when this is, and it is very clear that it is an uneasy question. It's not as simple as that. They're just different families. They all love each other as before, but, they just love differently. There is a lot of social unease and a lot of desire, which can be very, very, very wild. So any work on international migration from India, from any other part of the world, really needs to factor in the unease, the failures, the tragedies, the disruptions as part of the story. Right. So I just wanted to bring your attention to that also. The digital part, so again, semi-historically speaking, no, I have a very important question. I will not give up on that. So again, migration is an old story, right? And there is a lot. So there is the moment of the letter, and then there is the moment of the telephone, the big black telephone, and then there's the moment of the handheld mobile device. And there has been a lot of popular aesthetics around it, which work with the technological affordances of the devices. So the songs and stories and, on the letter is about the aesthetics of waiting, right? And the letter gone.
Waiting. Yeah.
Letter gone astray, the letter that never came, and such like. If you remember, you're probably too young to remember, but if you remember, one of the most interesting aesthetics of the black box, the black telephone, used to be the fact that you could never know who's calling until you pick story of anonymous calling, the whole story of what used to be called cross connections, getting in touch with people you had not intended to. And so many interesting narratives that came up from that. Then there's the digital moment where you are so rightly pointing out, you talk endlessly all day, and you may even talk about what you're eating, and you're probably eating the same thing every day. So you're repeating the same thing. So what's the aesthetic story here? What makes an art form, let's say, possible. It certainly does. I have no doubt that it does. I just wanted your thoughts on what really happens. The other thing, that there is no way that you cannot know that who's calling, almost now with the idea as well. There is no way that you can ever say that you can never not respond without being rude. So you also have to sometimes hide the fact that you have seen a message and stuff like that. There is a lot of anti-sociability or alternative sociabilities that's around this story. So what's the aesthetics of the handheld mobile device? And is it only for calling? Because you're showing smartphones to us. Are the parents only call? Are they not watching movie songs? And such like, So that's a long question. I'm sorry, but yeah, maybe there's something to think.
No. Yeah, thank you very much. These are some very thought-provoking comments, which I appreciate greatly. And you are quite right. The story of care collectives is not just a positive story, huh? It's not by far not. So it is, I mean, the transnational care collectives are actually showing people's struggle. So, how to make the most of the situation they are in, right? It is not easy for these children to leave. It is also not easy for the parents to let them go. And often there was basically they have several choices, right? One choice is, and a priest actually explained this to me in such a beautiful way. He told me his own story. He was also a student in Europe. He did his PhD in Europe, and then he returned to Kerala. And why? Because of his parents and parents-in-law. So the parents-in-law especially were very frail. And they had several options. Either they would stay abroad and they would provide the money for the parents, so then the parents would be able to get the healthcare that they needed, the surgery, right? The heart surgery, something like that. Or they could, one of the couple, so the wife could go with the children back to Kerala and stay with her parents, and then the husband would stay abroad. But he said, well, that's not feasible for me. That's not acceptable because I want my family to be together also. So in the end, they decided to all move back to Kerala. And so they were together, but then they couldn't afford the healthcare, the operations that the father-in-law needed, right? And so they were together perhaps for a shorter period of time because the father-in-law died, and then soon after also the mother-in-law. So it's a terrible dilemma, right? What do you do? Do you live away and then provide the money so that the parents can live longer? But then are they going to be happy if they cannot be together with the grandchildren? Or do you tear the family apart? That is definitely not easy. So, but the thing is that, and I also mentioned earlier that affect is not always just about love, right? So care is also not just about love. Care can be done out of the feelings of obligations or of guilt or of pressure and all that, right? And some people were also talking to me about, they said, well, these nurses, they're actually really in a terrible situation because they are forced to go abroad. They're, sometimes they use the word forced to go abroad and to send money. And then, will they inherit anything? Maybe only the sons will inherit, but the nurses who are daughters, they will not inherit anything just because they're daughters and so on. So you're absolutely right. This is not only about positive experiences or life without tension. It's always a conundrum. I just found that people try to do the best they can, often in the situation in which they are in. So, and that is always a struggle. right? So much for the first point. And for the second point, I really appreciate this idea of aesthetic. I haven't really thought of it in those terms, but I think it is worth further consideration on my part, for sure. One thing about knowing who calls, when I started my fieldwork, often actually, the children abroad would use internet calling. And that would mean that on the parents' devices, there would be a number that was really strange. So it wasn't about calling from a mobile phone to a mobile phone, but calling from the internet to the mobile phone. And then a very strange number would appear, and it would not be a number that you could call back. And it would also change a lot. So some of that suspense was still there. Perhaps that's changed with WhatsApp. And it's true that some of the parents that I talked to also, use their mobile phones just to take pictures. There was a father who showed me the pictures that he took of his wounded leg. And he said, oh, but it is fun. He had a cast and it was fun. And I just took some pictures. And so it was also for those purposes as well. I think that the most, the aesthetic, I guess, then has a lot to do with taking pictures. With the smartphones, especially. And that would also cater to the emotional management of this relationship sometimes, in the sense that some people were not really, they didn't find it easy to talk to each other on the webcam. And they said, well, the webcam has this very disturbing impact because it makes people acutely aware of the distance, right? So you can see another person, so you can say, oh, yeah, the distance is collapsed. But actually, it also makes you deeply aware that you cannot hold the person. You cannot smell the person. You cannot, do anything that you would do if you're physically together, right? So it creates this sort of what one grandfather told me was an unbearable feeling, the unbearable feeling of being able to see the grandson, baby, on the webcam, but not being able to hold it. And that's a new kind of feeling that the technology creates that is specific to webcam technology. So one of the mothers who worked in Oman by herself while her parents and her husband and her children were in Kerala, she said that she couldn't handle webcam calls. But she really liked receiving the photos. And she said, look, the photos of her daughters especially. And she said, on the photos, they always smile. And again, it's something that the photograph, the camera, to make a photo makes you do. It makes you smile. It makes you pose. And that was something that could, that could regulate the emotional response a bit. So yeah, so I think the aesthetic would be perhaps in the photographs, then that would be something to explore. But thank you for bringing my attention to this. Yeah.
Thanks, Tanya. And I just had a tiny question to do with, so you mentioned that this sort of mediated co-presence between families, that you're there, but you're constantly there, but you're not there. And you mentioned that feelings is something, I mean, the entire spectrum of feelings is what holds the transnational care collectives together. But how is this sort of ambient co-presence transforming the shared status of affect among families? So you touched upon that in your previous, your answer to the previous question. But I would just sort of like to know more about what your experience from the field was.
Oh, I'm not sure. I'm not sure I understand the question exactly. So is there something particular that you have in mind?
Why don't you give it another try?
I just wanted to ask that how is the digital moment changing the nature of the shared status of affect that families share with each other?
Yeah. I think affect is something that I would like to go in more depth in the future. It was not something that I paid a lot of attention to in the work so far. It was just clear that it is important But it's interesting, I mean, to consider, do people relate emotionally differently, right? From in this kind of collectives, I would say yes, and they're also trying to find out how to do that well, right? I mean, there are also certain things. Daniel Miller writes about that as well, and his co-authors, about how at one point the distances could even improve some relationships, right? It can remove some of the tensions from the relationship. So for some parents and children, it can actually be better. But it can also create new tensions. So if I remember, I didn't come across this kind of instances, but I remember that Daniel writes about, how some children felt that they were being surveyed by their parents, right? But he's talking about children in terms of teenagers and their mothers and fathers, mothers especially, being abroad. So, calling every day could also be a sort of surveillance. And in the case of families I worked with, there was also concern, especially for women who went abroad by themselves. It was also calling daily, was also about checking on them. Were they doing okay? Were they being safe? And so on. So there was this all kinds of, the frequent calling was not only about care for the parents, but also for the children. And sometimes it could even be considered as a sort of a checkup. I don't want to use the word surveillance, but perhaps in some cases it was. So yeah, I mean, the unbearable feelings that I mentioned, that is definitely a new kind of effect. That I think the most strongly came out of my examples. That's what I would say.
Okay, I'm Ravikant. I'm also a historian at CSDS. You came quite close to the question, answering the question that I have in answering Jaz's question. Let us extend the family, and we have extended families in India. Let's imagine the daughter as daughter-in-law, and she continues to call, and she continues to get calls, right? And she's in a new family. There's no background to this. She has to make a lot of adjustments. There are lots of expectations from the newly wed, groom also, because she has to now take to new ways of and adjusting the new.
Yeah.
So this question of surveillance, and if you're too much on the phone with your family, right?
Yeah.
It is seen as very offensive, and also it becomes especially it can be a threat if you come, family that has taken dowry, so all kinds of things. You are collecting evidence so that you can sue the guy who has obviously, taken dowry. So I mean, once again, it is connected to the question of when does the field work stop, because the family is not stopping when we are stopping our research. Thank you.
Yes. Well, can I answer?
Tanya, there's one more question from Shivangi, who's on online. So we just take one more question. So last responses. Okay. So if you don't mind, we'll take 3 questions together and one large response from you before we close for the day.
Sure.
Yeah, Shivangi, go ahead.
Hello, am I audible?
Yes, you are audible, Shivangi.
Oh, hi, Tanya. It was a wonderful presentation. As we recently chatted, I'm also working in the same field on transnational care circulation. I was just wondering if you can reflect more on what is the difference between tinkering and caring from your perspective.
Sure. Thank you.
Hi, Tanya. So actually, my question is an extension of Sir's question. So what I really want to ask is that during your field work, did you also come across people who were, say, older nurses? And this talk has been actually relatable for me because so my mother is a nurse. She's currently over 50 years old. But when I was, say, 8 or 10 years old. She must have been 34 or 35. She also went to find work in Australia as a nurse. And the plan was for us to eventually also go there and settle there. She, however, decided to come back, and that's a whole different story. But what I'm really interested in knowing is that during your fieldwork, did you also come across older nurses who were, say, married and had children? And
Yeah.
how does that change like meanings of care? And you also mentioned about idioms of sacrifice. How does that whole dynamic change when we take into consideration not just the parents of this person who is migrating, but also the kids and the extended family? Yeah.
Yes, thank you.
Okay, Tanya, the floor is all yours. Last words. We have
Thank you.
minutes. Yeah.
Yes, thank you so much. These are all fantastic questions. I mean, there's the question of ending fieldwork, and there's a question of ending presentations, right? There's also a very limited time for that, so it's quite impossible to talk about everything. But in the book, I really, as an anthropologist, I really was striving to get the most to paint or to show the situation in all of its complexity, or at least most of its complexity, if not all, because as anthropologists, we know that things are never simple. And I guess the question of affect then also relates to the question of dowry. So one of the most important things I found out is that within this transnational care collective, the filial obligations for daughters changed significantly. So, yes, I did include nurses of very different ages, from those who were about 20 and still studying to those who were actually already retired themselves. So all like a very broad range of nurses. And, so it included women who were not married and women who were married. And indeed, what happened often was that the nurses, not because they were starting to earn themselves, and with age and with time, they were able to negotiate about caring for their own parents much more than I would expect women in sort of a traditional non-migratory setting, right? So Sarah is a wonderful example of this. Sarah was a nurse who was in her around 45, going towards 50. She had 2 daughters who lived with her parents in India, and also so they were between her parents and her parents-in-law. And she had a husband who remained in India, and they completely basically switched roles, gender roles within the family, because she was the one who was providing the money, and he was the one who was actually caring for both sets of parents. So he was caring for his own mother by, taking care of the house and so on, but he also took care of his parents-in-law. And he told me, well, really, I don't care. Like, parents or parents-in-law, it's all the same. They're like our parents, and we have to take care of them. So I've read quite a bit. So I'm aware of this idea that when a daughter marries, she sometimes should even leave behind her mobile phone so that she's not in touch. So she cuts the connection to her own family and friends and so on. But that was not really the case in the families that I was encountering, especially with the older family, with the older women who were able to really negotiate their position and to say. So Sarah told me in the beginning, she did have some difficult conversations, let's say, with her husband about how much she will call, and also where will the money go, where will the money that she earned go. And she said, because of my parents, I am here. If they didn't invest in my education, we would have nothing. I wouldn't be able to go migrate. I wouldn't be able to migrate to get this education to earn this money. So that gives me a right to actually have some say about who I will call and where I will go when I visit India and so on. So when she was in India, she went between the 2 houses. She went between her parents and her own, so mother-in-law's house, right? Ancestral home. So there was quite a bit of negotiation. And the new tasks the new filial obligations that the daughters assumed as good daughters. I write this in the book, and I write this in the paper that's been published. So, and that I guess also answers a bit the question on older nurses and how does that, how do things go when there are children in question. So often these children would also be abroad with the nurses, not always. So in the case of Sarah, they were in Kerala, and she found it really hard. You know, she was one of the nurses who told me, well, I cannot talk to them on the webcam because then they cry and then I cry and then everybody cries, and it's like it's not a good situation. But she also kept in mind that what she was doing was sacrifice. So she continued with this idiom of sacrifice and suffering. And she said, I am here, I'm suffering, I'm giving away my years with my family members for them, you know, so that they will have the education and they will have a better life. And she made that very clear to them, that this was not, you know, something that she would prefer to do, that it was a great sacrifice on her part. It really was. It really was. She didn't, you know, she knew what she was missing by being abroad. But she really, yeah, made it clear for herself and for her family members that that is for the better of the family, of the collective, right? I hope that answers your question somehow. And then Shivangi, you were asking about tinkering and caring. There is a difference. The difference is that tinkering is really about trying out. Tinkering can be related to any other things, not only caring, also to any other thing. But tinkering really refers to trying out what works, right? So does this mobile phone work? How does my mother or my father use this phone? Maybe this is a phone, or maybe that's another phone, or maybe they can use a laptop, right? So it's about tinkering is finding out through trial and error. And caring is something completely different, right? It's a practice or it's something that is enacted through the practice of tinkering. I hope that makes sense. But if you want to learn more about that, then really look at the book called Care in Practice. Yeah, it's an edited volume, and there is especially the book by the chapter by Miriam Winons, who also wrote about care collectives. So that's where I got the
Can you repeat?
The book is called Care in Practice.
Yeah, and the chapter?
By Winons. I also quote it in my work all the time.
Oh, okay. Okay, great. Thank you.
Yeah, and I think it's open access also, if I'm not mistaken.
Wonderful.
Yeah, that's most needed. Thanks.
Lovely, Tanja. That was wonderful. Lovely having you over, even over this distance. But hopefully, whenever you're in India next, we can have you at the center. So thank you very much, and see you another time. Thank you, everyone.
Thank you. Thank you so much for your invitation and the presence and questions. And I also hope next time I'm in India, I will definitely be in touch. So hopefully I can come for a visit. Thank you so much. Take care. And of course, if there are any other questions, please let me know by email. I'm happy to help. Take care. Bye-bye.